What is going on, guys? Today we have a very, very special interview for you. So we sat down and we spoke to Dr. Nathan Kupperman, who owns 5 offices in the Tallahassee area. We spoke to him about all things pre-dental, dental student, dental school, tips to survive in dental school, tips to thrive, tips on how to, get the most out of clinic, all of the good stuff that you guys want to hear. So enjoy the episode. Give us a like, give us a review, email us your questions. You just have to let us know what you want. So I hope you guys enjoy the interview. Until the next time, vibe on.
All right, guys, we are back at it again. My name is Seth and I am here today with Lori Gruskin and our 2 special guests, Dr. Kupperman and Dr. D'Anna. How you guys doing today?
What's up?
Doing great, good. Hanging in there in these chaotic times.
Chaotic times, absolutely. So Dr. Kupperman and Dr. D'Anna, they are up here in North Florida, and they are working at a couple dental practices. Right now we are at FSU, and this dental practice, probably one of the most interesting dental practices I've ever seen. It's within the health center, right? It's like, what floor are we on right now? The 4th floor? Third floor? Yeah, and it's buried deep inside here, but it is cranking out patients, and you guys got pretty good production here, right? A lot of students, you see?
Yeah, we sure do.
So let's start from the very beginning. Give me your whole story. Give me everything that you learned from your path from pre-dental to dental school, and then now we'll get in later into your journey into private practice.
Mm-hmm. Well, I will start how we initially got established. We are a network of 5 offices at the moment. Dr. D'Anna and I both went to the same dental school, Denovo Southeastern. Mm-hmm. And when I graduated, I was actually an employee for 2 years. And through that, I ended up resigning that position because I wanted some more independence. So I started my own contracting company, and I began contracting about 12 different offices. So that kind of allowed me to get a lot of good experience seeing different types of offices, from fee-for-service, Medicaid, PPO, and just kind of getting some experience. Now, through that, I ran through 3 offices that an individual doctor had unfortunately gone through some tragedy with losing his son, and I ended up being able to acquire the 3 offices at once because he was kind of left on his own. And that's kind of how I initially got started. And then through the growth, I managed to have a relationship with Dr. D'Anna, and he ended up kind of seeing my vision and kind of buying into that. So.
Right, and that's like really important, is to have the vision from the outset, right? So you know where you're going. Like a lot of people, they just get out of school and they're just like, okay, I'm just going to get a job. And I think it's great that you had like a vision and you know where you're going.
Yeah, and I think that, there's a lot of options out there when you graduate, and there's a lot of corporate options. But I think the revolving door of associates, it's not a feel-good thing for a dental student coming out.
Right.
You want to be established somewhere. You want something long-term. You want growth, clinical growth and business growth. So that's why I think, models like this, these dental provider organizations, are very valuable for dentists today.
Right. Dr. D'Anna, tell me about your start.
So if we go to like pre-dental days, I guess I knew I wanted to do this, since I was in high school. And then, so I grew up in Michigan. That's where I went to school. And then I was hoping to get into my state school. That didn't turn out. And then I got accepted to Nova. And as I was coming in, Dr. Kupperman, I met him. And he was graduating. So he kind of was like the one that kind of showed me the ropes of dental school. So he was kind of a mentor in that way. And like over the 4 years that he was associating and then bought these practices, like we stayed in close contact. He would, send me like, books to read, clinical stuff. So, and then, when I was deciding what the heck to do after dental school, I was talking to a bunch of dentists back home in Michigan and kind of weighing my options. And I'll be honest, even my friends said it. They never said I was coming to Tallahassee.
Oh,
I never,
yeah.
I never believed it, but I got spoiled with the palm trees and stuff. And I didn't want to go back to Michigan, so
it's a lot different.
Yeah, so I visited here, loved it. I mean, beautiful weather, very just people are just, salt to the earth. And, talking with him more, I kind of, I saw what he was doing, his vision, and like I knew that I was going to have mentorship from someone like my age, not someone, because back home I was talking to all these like private practices, and they were like, I don't know, how I could offer you what he is, like they're 50, 60-year-old docs. Like I know, like at the end of the day, like I'm not going to be able to call them and be like, hey, what'd you think of this? Would you, they just don't have that time.
Right.
And like the procedures, I was sensing that, in a solo, like not many offices have so much room for two docs, like I knew I could just sense I was going to get the scraps, the basic,
that's a problem a lot of people face.
So, in a way I took a chance. And I talked to Dr. Kupperman. I was like, let's try this out. So I came up here and I started working. And it was way better than like I could imagine. Like everything he said was true. Like and we're sitting there and I'm doing like root canals and learning the systems and crown and bridge and extraction. So it was just nice to have that support there, because I don't know, for me that's what I wanted. I wanted growth and the ability to just like learn. And so what's cool here is it's not just him. So you have, we have Dr. Morgan, who's like, 30 plus years of experience. So, and you have another doctor, Dr. Mark, and like, guys that have been doing it. So I get to see that and, bounce ideas off of them. And so we've kind of like, learned, like we all kind of talk, which is cool.
Right.
Like the group practice model, I think is like the coolest thing here. But
that's what a lot of people appreciate about group practice dentistry, is the ability to talk and just share cases and everything. And because you hear about these guys that are 60, 70, and they like their whole lives, the only people that they could talk to was at their local like dental clubs, like that sort of thing.
The biggest thing it creates is accountability, because you have multiple other doctors looking over your work. We're all constructively criticizing each other in a way, but we're trying to elevate each other at the same time.
Right.
Because we have a certain standard of care that we want to keep. And when you have multiple doctors, committed to that standard of care, it makes all your clinicians much, much better.
That's awesome. I love that. Okay, so guys, can you take me back to, think way back, getting into dental school? So you remember your dental school interview? Tell me a little bit about that.
Dental school interviews, I think, were just kind of intimidating from my recollection. But one thing that I really liked to do for dental school interviews was going on Student Doctorate Network, and they would post potential interview questions.
Right.
A lot of times,
helpful.
A lot of times too, it would be recent interview questions, so you can kind of get prepared. But I think one of the biggest things is that dental schools want to show that you've actually been involved in the field of dentistry, that you've actually, been a dental assistant or been a lab tech, or actually know what you're getting into, because a lot of people think they want to do dentistry, and a lot of people are really smart, and a lot of people have really good scores, but there's some people, they get into school and then they realize, oh, this isn't my passion. So that's one thing that dental schools want to avoid, because, that's a big tuition for them too. So they want to make sure that who's ever coming in is going to be, committed as possible. So, but I don't know what your thoughts are on that, Dr. D'Anna.
Yeah, it was definitely stressful. I remember, I interviewed at, I remember University of Detroit Mercy. That was a, standard, just, why you want to do this. I interviewed at LECOM too. That was more the group setting, but Nova just stuck out at me because it was just like everyone was very positive, relaxed, like happy. There was some, I was walking through the clinic area, and there was, outside there was some guy playing like the harmonica. I was like, is this staged or what? Because this is just too beautiful.
Really?
I was like, what's going on here? All right.
That's
like,
interesting.
Like, I'm sold. Okay,
Yeah,
let me in. But it was nice because it was more of a relaxing interview. But what's funny is like looking back at it now is like, they know, they can sense like if you really want to do this. And I say that because like at this FSU office, we have another doctor, Dr. Lupu, and we have a lot of shadowing students. And they come in and, and they tell us why they want to do dentistry. And you can spot pretty quickly like the people that are, just doing it because of the lifestyle or
Like you can see the people that have passion.
Exactly.
You know?
Yeah, and you can sense it right away.
Right.
Like if I'm doing a procedure and they can't even, if they have they're just sitting in the corner like 5 feet away while I'm doing a class 2. It's like, okay, they have no interest. If they can't even like ask me questions here, like, why are you doing this? And we drill the students sometimes because it's like this is a big investment. Like,
Yeah.
You need to like, you got to know what you're getting yourself into. It's not all rainbows here. It's like it's a lot of debt.
Yeah.
And if you're not prepared and don't know what you're getting yourself into, like a year, 2 years into practice, you can be like, what the heck did I just do?
Yeah.
I don't like this. So
Yeah, it's definitely got risk to it. Do you guys mind me asking how much you came out with in debt?
yeah,
Yeah.
550.
550.
Yeah.
I'm right under $500,000.
Yeah.
But thankfully, student loans have been postponed at the moment.
At the moment, right?
And student interest, I believe, has been postponed. So that kind of helps you out a little bit. That's why I say, too, that federal debt is probably one of the best kinds of debts that you can have because there's just so much relief available that's supplied by the government. Because who would have ever seen this whole situation coming?
Mm-hmm.
And a lot of normal debt that you would have with banks, they'd be like,
Yeah.
good luck.
Right. So I mean, that's some good advice, especially for people taking out loans. Definitely use private loans as a last resort, right?
Well, think about it too. If I was paying back all my student debt right now, I would have no cash reserves to float my business and I would go bankrupt. So these are things that you want to think about. So
Exactly. So how far out do you usually, do you have like 6 months emergency, just cash flow, or like how much do you put away?
Pretty much, yeah, about 6 months. I try to do my best. And the thing is too, since I'm not a huge business, I'm a little bit smaller. So, 6 months is more possible, but for really, really large organizations, I mean, it's almost impossible for them to make it through 1 quarter.
Yeah.
So I'm really hoping that, all this Corona stuff kind of starts to settle down.
Let's hope so.
At least within the first, 2 or 3 months.
Yeah, definitely.
Yeah.
Have you tried to refinance your loans yet?
Oh, absolutely not. Absolutely not. Yeah, I would not refinance my
Right.
loans. But again, too, it's all about what you want. Do you want to be an associate? Do you want to work? Do you want to have no further business debt? Or do you want to grow an office and be able to take out more debt, to leverage debt, to create, practices?
Right.
Because you have to ask yourself that. Because if you don't have any reserve capitals when you go to apply for a loan to buy an office, no bank is going to loan you money. As opposed to if you just plan on being an associate long term, pay your debt off as soon as possible. But if you want to be a business owner and an entrepreneur and leverage debt to create wealth, then you do not want to pay your student loans back.
Right.
And that's a big mindset shift because like hearing that and what common sense kind of tells you, like that took me, my D4 years when I really started to dive into like different podcasts, different books, and I'm sure we'll talk about it later.
Yeah, we will.
But that is important because if you don't get the mindset right, you're going to get caught in the rat race.
Right. It definitely, yeah, great advice to educate yourself with whatever you've got out there, any resources. So moving right along here, tell me about what's like the best advice you would give to a student that's about to start dental school? And then we'll go work our way into clinic when you start clinic.
Okay. My first thing for a dental student about to start dental school is the second you walk through those doors, start networking and mingling and becoming friends with your D2s, the people that are a year ahead of you, because they've literally just gone through exactly what you've gone through. What better person to get advice than someone that's just gotten all good grades in the classes you just took, that's just gotten good clinical scores on all the exams and stuff that you had to take. So that's the number one thing. And then you can kind of backtrack from there.
Yeah, I would have to agree because, I had, Dr. Kupperman, I had, he kind of, through him, showed me a network of like older D4s and stuff. And I mean, it was invaluable because they had been through it. And what happens is like your D1 year, you're all going through the same thing. And it's how do I want to say it? It's kind of like there's a lot of fake hysteria and if you're
ironic, huh?
Yeah, it's kind of ironic, but you have to be careful because it's like little stuff and it can drive you nuts. Like there would be times where I had to just kind of distance myself from those certain people because it was like, oh, if I don't do this, the world's ending. It's like, no, take a step back, relax, like we're all going to get through it.
Right.
And then, another thing was for me, I kind of knew right away that I wasn't going to specialize. So it took, I mean, it's not that I stopped studying, or it just took a huge load off of the pressure of like doing absolutely perfect. So for me, I was able to kind of, because there's a lot of fluff in dental school, stuff
definitely.
that, in my opinion, isn't really applicable. You know, like you need to learn, you know, the Krebs cycle, do that. But for me, reading these different books, listening to these different podcasts, like you're going leaps and bounds,
Right.
as far as preparing yourself, you know, and like joining your, whether there's a business club, dental business club. I know at Nova they started that. Is huge.
Absolutely.
The dental fraternities was too good.
Yeah.
I mean, what were the ones again? I think mine was SIO.
And it was
And then Alpha.
Omega.
Yeah.
They were great because, you know, they helped you with your
great
classes,
networking.
networking, and also, I mean, you know, having some fun too.
Right. Okay, so I'm about to enter clinic in hopefully 2 months. So what advice can you give me and all of my colleagues about when starting clinic? And so at our school, we go to clinic and that's about it. We're in there all day.
Well, I guess, you know, try to see as many patients as possible. There's going to be so much red tape between diagnosis, you know, models and actual treatment. So you just really got to try to do and see as much as you can. You really have to take initiative, because if you don't, then you're not going to get much clinical experience. Another thing too is coming out third year, once you know, go into Stab Lab, you really want to look at those videos, look at the Malmed videos for injections for anesthetic.
What is it called?
Malmed.
M-A-L?
M-A-L-M-E-D, I think.
Okay.
But it's on YouTube, because profound anesthetic is one of the most important things of dentistry, and that's probably one of the first things that you're going to get exposed to your third year in clinic. So this is very important stuff. I don't know if there's anything you want to add to that.
Yeah, I mean, you need to be in clinic like nonstop, whether you don't have a patient, whether you don't. I mean, my biggest thing was I love like talking to the professors, and you know, they're not all created equal. You know, some of them don't have a lot of you know, outside of experience. So you need to find someone that you know that knows what's up, and just extracting as much information. I mean, they're there to teach you. Like the people that the guys that were there, that, you know, they weren't doing it for the salary. That's for sure. They were doing it because they love to teach, and you know, gathering that information and pushing yourself too. You know, not being scared to try different things, but going to the specialty clinics. You know, going to oral surgery, talking with them, the endodontists. It was cool that we had a lot of specialties at our school, but you know, and also downside was they would take a lot of the procedures, but that's, you know, it's not a big deal. You just have to, you know, you learn.
And as you get more exposure, you start to kind of discover, what's my clinical passion? What do I really like? Do I like root canals? Do I like extractions? Am I obsessed with cosmetics? And then you can kind of cultivate that and say, all right, if I like one thing, then I'm going to go hang out in the specialty, you know, sector. And that's one thing that was great about Nova, is we had every single specialty, you know, on the second floor. So personally for me, I lived in the oral surgery clinic. I was watching these guys daily take out impacted wisdom teeth. I was just obsessed by it. It was just awesome. You know, the fancy drills, the buckle removal bone, the buckle hockey stick retract. It was like blood and guts. And it was intense. I was like, wow. I was like, this makes me feel like, you know, a real doctor. So I was really into it. And then, you know, for other people that really liked endo or really like perio, they would go. And for perio too, I would shadow some of their procedures when they're, you know, doing ridge expansion. They're doing immediate implants. They're doing a lot of stuff. So that's kind of what my passion was. So you got to kind of ultimately figure out what's your passion clinically, because that's going to drive you to be much more successful later on in your career.
So I guess you're really saying just try and experience everything and find your passion, what you really like to do. So you like to do oral surgery. What do you like to do, Dr. D'Anna?
Endo.
Yeah.
Endo?
Which I never...
He's an endo geek for sure.
Yeah.
Which I never thought like that was like gonna be my thing or whatever, but I just like, I don't know, I'm in there and I just love it.
Yeah.
You're trying to find
Molar
the
endo?
canals.
Yeah.
How fast can you do a maxillary first molar?
It depends. If we get a 19-year-old FSU student, we're gonna knock it out. But if we're in the boonies and it's calcified, you're gonna sit there. I mean, it's you got to be realistic. And
You found 6 canals yet?
No.
I have found 6 canals yet. But one thing too that I like about Dr. D is he's constantly expanding on clinical improvement. So he's kind of discovered these different instruments, these different scout files, things that I just didn't even realize existed. So that's, again, comes back to, working with a group of doctors, just being able to find new clinical techniques that work. But Dr. D, I mean, he has been out of school for about 7 months now, and the fact that he's able to do molar endo so competently is very remarkable.
Right. Yeah, that's awesome. Because I was listening Howard Ferran, and he was interviewing with the CEO of Heartland, and he was saying that the way that they judge that a practice is doing well for a general dentist is doing 7 endos a month.
Yep.
So, I mean, that's a good
I've heard that too.
KPI. You heard of that?
Yeah, I listened to the CEO of Heartland speak, and that's exactly what he said. There is a delineation between the Denovo Success and not. And the Denovos, if they didn't do 7 endos within the first month, they went out of business, which is just
That's
interesting.
wild. Yeah.
And the thing is, the main concept you think about is a patient comes in and they're in pain. It's a new office. You charge them money, you don't get them out of pain, and then you send them on their way.
And they never come back.
And they never come back, and all they're going to do is tout around town about, oh, I paid, $150. I didn't even get out of pain. I had to go to another office that actually took care of me. So that's just kind of some food for thought.
Right.
Yeah, and it's not, I didn't walk out here and, start doing molar endo. Like, it was steps, and thank God I had, Dr. Kupperman, if I was in a jam, he would help me. But there was, there was a couple teeth that got lost in the process of learning, you know what I mean? But it's not, it's not like we were reckless. It just, you have to learn, you tell the patient, hey, we want to save this tooth. But in my opinion, someone comes in pain, it's the first molar, you got to know how to do it.
Absolutely.
Yeah, I appreciate that, guys. So, what advice would you give yourself the day that you graduate, looking back right now?
Graduating from dental school or graduating from undergrad?
From dental school.
I'll let you take that one first, Dr. D, because I got to think about it.
I was really nervous.
Yeah.
In so many, I didn't feel really prepared. But just to, the worrying doesn't help.
Right.
It sounds kind of cliche, but trust the process. Every day, Monday's going to be good. Tuesday it could be not a good day.
Yeah.
But then there's Wednesday.
Yeah.
And just keep on going. Every day you get a little bit better. And just for me, I stress. I worry a lot. I take my work home with me.
But maybe that's kind of like a call to action, and maybe you take more action than you wouldn't if you weren't worried about it. You know what I mean?
Yeah, exactly. I just relax. It's gonna be okay.
Okay.
Relax.
Yeah, absolutely.
Did you think about doing a residency, or was that not something you were planning on doing?
I did. That was a big struggle, for me, because all my friends were doing GPRs. A lot of my mentors told me to do it. I still think it's a great thing for certain. You need to really, and they told me this too. They're like, you need to decide for yourself. Some people, I think, do need a GPR, just to get their confidence a little bit up, and especially if in dental school you really didn't do a lot. But my mentor told me, he's like, it gives you a year to kind of decide what you want to do and to polish up your skills. And talking with a lot of my friends that are in GPRs, some are pretty happy. Some maybe aren't getting the experience that they wish. But for me, when I really thought about it, the only reason I was going to do it was because I was scared to jump into the real world. And so when I realized that was the only reason I was doing it, I was like, no, I gotta get out there and just face the music.
It's pretty interesting too, working with and interviewing multiple new grads and kind of seeing the progression clinically. And I've interviewed ones that have done GPRs. I've mentored new grads into becoming clinicians. And I think one of the biggest things I notice is that it has a lot to do with the confidence and the repetition. So that's one thing I definitely notice. It's even at a GPR or straight out of school, there's just a nervousness. There's an experience, and that really cuts into your overall confidence. But once you kind of, you have to crawl before you can run, right? So the slow development, but usually it's after a month or two of being in a real practice setting, it's amazing to see these new grads just grow and like flourish. And it's like all of a sudden, they don't need to have a doctor over their shoulder like all the time.
Right.
And at the end of the day too, everybody's going to get in a jam. I don't care what doctor you talk to. I don't care if they've been practicing for 10 years. Every doctor gets into a jam in some situations, but that's why, again, it's nice to have a support network of doctors to have a reference for.
Right. So what are you guys thinking for most dental students? So you guys both went on a little bit of different paths, right? For most dental students, we've got options right now. A lot of students are going to DSOs. Some students are going to private as an associate, and then other students are going into residency. So which kind of student do you think kind of fits in each one of those? Can you categorize that, or it's just kind of like your situation?
Maybe
right?
a more academic student belongs in a GPR because they want to develop more academically, and that's going to be an academic structure that they're accustomed to. Maybe the more gregarious, outgoing, good bedside manner is going to want to go out and work immediately because honestly, bedside manner is one of the biggest things associated with that.
Right.
And then you have some people that are just very clinically advanced, so they can kind of do either or. But yeah.
Okay.
Yeah, I would agree with that. I mean, some of my friends in dental school, they were like, they were ready. I could tell, like, there were no questions. Like, they knew they're like, I'm ready to work. So I think it's definitely a confidence thing. And then, the friends that went to GPRs, they were looking to learn those like really specific procedures, like, implants and, et cetera, which if you don't have a mentor to teach you that, it's going to be very hard. It's going to be a little bit harder to do in private practice or in a DSO. But, a lot of, there is some, friends that I have with DSOs that, they're getting a lot of experience. And at the end of the day, it's just reps. You got to get it. And, if you're alone, it sucks,
The mentorship is very important because the way that I feel about Dr. D, it's like after his mentorship, he's where I was at clinically after practicing for almost 2 years. I just didn't have quite as aggressive a mentorship. When I went and I worked, it was the doctor didn't do endo. The doctor really didn't do surgery. So he was like, all right, well, you can do this. But he never actually really did. He never actually really mentored me.
Oh, okay, yeah.
So that was one of the biggest things. So, I had to do a lot of CE. I had to watch a lot of JB Resnick, which I kind of talked about before, and just kind of go on mission trips and get that experience that way and practice endo, So I never really had that direct mentorship. And it's crazy to see how quickly, a new grad, like I said, can advance clinically if they have the proper mentorship.
Right. All right, awesome, guys. So let's get to some of the resources that dental students, pre-dental students, and new dentists can take a look at. So what are some good books?
So resources for pre-dental students, first, I always say Student Doctorate Network. That's one of the the biggest no-brainers. I love DAT Destroyer. I love Crack the PAT. These are just like some essential books because at the end of the day, that admissions test, it's kind of superficial, but it's essential. You have to get high scores on your DATs. For dental students, I would say the first 2 years, just get through the academics.
Right.
You're going to have so much on your plate. You do not need your mind wandering on all this extracurricular business, entrepreneurship, clinical stuff. You need to focus on passing your classes, getting good grades, and making it through. Now, once you start to get the third and fourth year, then you have awesome resources. You have awesome clinical resources, which Dr. D can agree with me, but, Dental Town, they have a free student membership. You have over 330 continuing education hours. So that's kind of one of the biggest focuses.
So you watched the CEs on Dental Town?
Oh, yeah. I lived on there, man.
Yeah,
It was amazing. It was fantastic. And now this guy, too, Dr. D, I mean, he's spoiled rotten. He's got Implant Ninja. He's got Spear Education. He's got JB Resnick now has his own oral surgery website. I mean, like, dude, I wish I had this stuff when I was in dental school. So it's pretty fantastic. Now, for business books, you've probably heard this a million times, but E-Myth is like one of the most essential. You're basically dead in the water if you don't understand E-Myth and those basic, concepts of cash flow and whatnot. And then also there's, the Affluent Dentist is another good transitions book. But yeah, I don't know if there's any books that you wanted to add to that, Dr. D, or CE.
Yeah, no, I would say start off with Dental Town just because it's free and there's so much. There's so much stuff.
Where could somebody start with Dental Town?
The JB Resnick oral surgery.
Yeah, you started.
And that's really good protocols because it goes over, health risk, patient health history, all the different kind of like particulars that you need to look at, like, blood thinners, bisphosphonates, and other things like that you really, really got to focus on.
Yeah, there's just not enough. There's not enough time to go through everything.
Yeah, definitely not.
It's literally just flooded with free information. These are like recorded, CE events that doctors pay thousands of dollars. You can just sit there and listen to them, watch them. There's message boards. But then from there, I mean, it's like, the JB Resnick, he has like onlineoralsurgery.com. I use that. Real World Endo is for, good for endo, but Spear Education, like D3, I mean, that is the best.
Spear.
That's the best online education, I think. And it was awesome because, I had a lot of good friends in dental school, and I was like, hey, like, you guys want to split this? You guys want to do this? And like, it was like, a mix. It was like about 10 of us that it's hard. You know what I mean? You're done with clinic, and the last thing you want to watch is a freaking dental video. It's it pays dividends,
right?
Because you understand it to another level versus. But
I know Dr. D's a huge fan of Howard Farran's MBA.
That's another thing. Is the 30-day MBA.
Yeah, I started watching that, but I can't get through the first like 3.
Yeah, it's wild.
Episodes.
For Dr. Howard Farran, I love the guy, but you got to take him in doses for sure.
I would say bounce around. You don't even have to go in order, but you're gonna learn to like love him. The guy's hilarious, and he just like the way he presents like just the dental field in like a nutshell is good.
He tells the same stories like every single. It's hilarious.
He's hilarious.
Yeah.
He's
I can like tell his stories now. I've heard it so much. But okay, so Howard Farran, also his podcast, right? Any other podcasts you guys like?
That podcast is good. There's like the Dental Practice Blueprint. I think it's with David Phelps. That's pretty good.
Yeah, David. He's real into real estate now too.
Yeah, and then there's also Mark Costas is I think it's a
Dentalpreneur.
Dentalpreneur. Yeah. I mean, Mark's great.
Yeah,
he's got good stuff.
I love that one.
Yeah, and that was another one of his books. I think it's like the success.
It's like the pillars of
dental success.
Yeah, and it's great hearing his story. It's very motivating.
Right.
The other, my favorite, I think, like the biggest impact it had was shared practices.
Oh yeah,
because that it's in seasons, and like the first season is basically like, hey, like being associate is great, but it's like a complete mindset shift. It's like you want to get out of this debt, you need to become an owner or get become you can't pay off loans with $100,000 a year as a W-2, and it's not, the math doesn't work. So it's and
what they're doing now, it's they kind of transition shared practices into, it's called like practice underwater. I don't know, have you heard of that yet? And they're just doing like dental consulting, and they just have people like call in and they make them anonymous. They like change their voice and everything, and it's pretty sweet. And it's just straight up like you get to listen to the different consultations.
Last one, a new one that I've been listening to is I think it's called The Lifestyle Practice. It's with Justin Short.
Right.
So Justin Short is like he's a pretty funny guy to listen to, but you have kind of his like the guys that kind of followed him. Then Derek Williams from Midwestern University, and these guys are like very bright. And they came out of school and like I'm pretty sure they did a startup like right out of, or bought a practice right out of school, doing like really good. So they're some good guys to listen to. And there's with that said, there's actually a group that Derek Williams created. It's in Dentaltown. It's called Ambitious Dental Students.
Right.
That is gold.
Yeah.
So it's you got to get either an invitation or just like sign. I forget how.
I just did it. I just signed up for it. It's just like you apply and they just like somebody accepts you. It took like a month, but
but it's
definitely worth it.
Gold in there. The books, everything.
Yeah.
So.
Yeah. That's good. Hey, we all know the same stuff. Yeah. I mean, the stuff that's good,
it's out there. No one's hiding
out
it.
There, yeah. So, all right, cool. So, Dr. Kupperman, can you tell me a little bit about the NAC Dental Group and kind of like what are your plans for the future?
Okay, so NAC Dental Group is just it's kind of it's a dental provider organization. And what it does essentially is it serves as a purpose for management services, for payroll, for marketing. It also serves for recruitment, because I think that's one of the biggest things that group offices struggle with is recruiting quality people. Because that's what we're about. We're about quality dentists, quality assistants, quality hygienists. We want to bring a bunch of high quality people together to do great things, and that's kind of why I created it. Because initially it started off as me just getting these offices And I'm kind of like Heartland to where I keep the offices the same name. You know, I don't want to change. I don't want to change something that's worked for so many years. Yeah. So I keep the offices how they are, but then in the background I have the management organization that's, you know, kind of overlooking everything. And as is, you know, the chief financial officer of the company, it helps me be able to really closely monitor the cash flow when all the capital and everything is flowing in and out of one entity, as opposed to me having to monitor, you know, several different ones.
Right.
But yeah.
That's awesome. And so you've been how many years out of school now?
5 years.
5 years, and you're already managing this. Like that's such an incredible accomplishment. So I really respect that. So can you guys give me your contact information? How can our listeners reach out to you? Like email or Instagram, whatever.
Yeah,
whatever you guys want to share.
If you guys ever want to reach out to me, first of all, you can check me out on my website, which is nakdentalgroup.com. And you can reach out to me personally at nkupperman@nakdentalgroup.com.
Yeah, I'll for me, I mean, email's fine. Calogero D'Anna at me.com. So CALOGERODANNA.
Okay. You guys big on the IG, posting cases, anything like that?
Yeah,
not yet. You're building it.
I've thought about it. It's just like I'm not big on like posting stuff. It's I don't know. I'm just like I don't know why. I haven't gotten there. Like I've been trying to take like a lot of pictures of my cases and stuff, but what I do is like me and my friends like that all got, it's like 20 of us that got at dental school. We created basically like a group chat, and I just thought it'd be cool to like, you know, whether you're having a bad day or you want to share something or you're in a jam, like you go on that WhatsApp and we're talking about it. So that's like, I don't know, for me that's like my outlet of clinical.
Definitely, yeah.
Yeah, any further questions or concerns too, you can feel free to reach out to me on my Facebook or my Instagram. It's just Nathan Kupperman DMD, and you can pull me up instantly on Facebook or Instagram. And again, too, I'm very open about answering questions. Ultimately, I think dentistry it's like a ladder. You know, you climb up the ladder, you're at the top of the ladder, and you slowly start helping people, pulling people up. And that's just the journey of dentistry.
Yeah.
So
awesome. Thank you guys so much.
All right, guys, this will do it for our first part of our interview with Dr. Kupperman, discussing all things about dental school, getting into dental school, and thriving while you're in dental school. So you guys know the drill. Follow us on Instagram at dental.student.vibes. You can follow us on Facebook at Dental Student Vibes. And make sure you guys check out all of the awesome apparel that we've been putting out on Teespring. Be sure to drop a review on Apple Podcasts or any podcast platform that you guys use. And make sure you guys send in questions, comments, concerns, anything we can do to get better. And as always, vibe on.